today we're going to discuss about implant impression techniques. Okay, so what are the different impression techniques for implants? Okay, so to record impressions for implants, we have different techniques. They are basically classified into two, such as abutment level and fixture level, or also known as implant level impression technique. Okay. So what is basically an abutment level impression? To restore an implant, you need to have an abutment. Okay, so the abutment is the component which connects the implant to the crown. What is an abutment level impression? The implant is basically placed within the bone and the gingiva covers the implant. So what the abutment does is it brings the connection from within the bone through the gingiva into the oral cavity. So in this technique, we place an abutment on the implant and tighten it in the patient's mouth. And then as we would take impressions for any crown and bridge, an impression is recorded. The advantage of this procedure is that it is very easy to perform as most of us are used to taking these kind of impressions. You do not need any additional inventory. But on the downside, this is not an accurate procedure. As we are recording the impression of the abutment, we are only able to reproduce what's outside the gingiva. As you know that the implant is placed subgingivally within bone, we are not able to capture a majority of the portion of the abutment, which is within the gingiva. So this will lead to reduced surface for retention, and also the crown will not have a proper margin. So what are the drawbacks of an abutment level impression? So as discussed, we will not be able to get the margins correctly as most of the time the margins are subgingival and those will not be recorded in the impression. The accuracy of the impression will also be poor. And also while pouring the cast, the stone or the stump which will replicate the abutment will easily break as they are very thin. Another disadvantage of the abutment level impression technique is that if you require to modify an abutment, like reducing the height or correcting parallelism, we will have to do all this in the patient's mouth. That is, we will have to mill the abutment, reduce the height, make it parallel. All these things will have to be done in the patient's mouth, which is going to lead to an extended chairside time and also discomfort to the patient. But when you have an abutment which is equigingival or supragingival, in those cases alone, we might be able to do an abutment level impression. Otherwise, in all other cases, we have to go with something which is known as the implant level impression. What is an implant level impression? The implant level impressions record the position, angulation, and depth of the implant. And we will also have an implant replica in the master cast that will serve as a duplicate of the implant for us to work on. So now, when we have a cast with implant replica, we can easily see the margins of the abutment, make necessary changes to the abutment, or even fabricate a customized abutment as per the needs. The chances of error is reduced, the amount of milling of the abutment in the patient's mouth is reduced, and the chairside time is also reduced. And as you can see in these pictures, these abutments or these impression copings are placed far more towards the buccal. Now, if I need to make it parallel or if I need to bring it to the arch, I would have to reduce a lot of the buccal side of the abutments, which will take a lot of time in the patient's mouth. If I can do this in the lab, this is going to be more easier. So if you have a implant level impression, you can do all this in the lab. So what are the components required for an implant level impression? You will need a few extra components like we have already seen. We need an analog or an implant replica. An implant replica will always substitute an implant on the master cast. It would be in the same position as it is in the patient's mouth. It will be in the cast. Then we will need impression copings or transfer copings. We will also need healing abutments to be placed between impressions and restoration of the final crowns. But if we are taking an abutment level, we don't need all these components. In implant level impressions, again they are classified into two. They're commonly known as closed tray impression technique and open tray impression technique. Closed tray technique is also known as indirect transfer or transfer impression, whereas open tray technique is known as direct transfer or pickup impression. So what is indirect transfer? Indirect transfer is known as closed tray impression technique. So for doing a closed tray impression technique, we need a particular type of impression copings. They are basically used to transfer the position of the implant into the impression. As the name denotes, closed tray, we will be using an impression tray which is closed above the implant. That is a normal impression tray as we use for a normal impression, crown impression. So the impression coping used for the impression will have a flat surface or it can have grooves as you can see on the blue coping so that it would be easier for us to reinsert it back into the impression without any change in the direction or depth or even the rotation of the implant. So what are the steps in doing an open tray coping impression? So first we will attach the impression coping to the implant, and the most important step is to take an IOPA to determine if the coping has been seated fully on the implant. If it has not seated properly, the impression will not be perfect and there will be discrepancies in the crown that is made on the cast. So never forget to take x-rays before taking impressions for implants. So after the x-ray is taken and we confirm the seating of the impression coping, we take the impression using a putty light body. Once the impression is set, the impression will be removed. And once the impression is removed, the impression coping will still be in the patient's mouth. Okay, so the impression coping is removed from the patient's mouth and is connected to an implant replica, or also known as an implant analog. Okay, and then it is placed back into the impression according to the orientation grooves present on the grooves on the coping, and then a cast is poured. So since we indirectly transfer the coping from the patient's mouth to the impression, it is called transfer impression or indirect transfer. So basically what we are doing is we are placing an impression coping in the patient's mouth. An impression is recorded. The impression is removed. So once the impression is removed, the impression coping, which is still in the patient's mouth and it is attached to the implant, is removed, and then it is connected to an implant analog, and the impression coping is transferred into the impression which has already been taken. So this is where the grooves or the flat surface of the impression coping comes into play. So if you know that you have placed your impression copings with the flat surface on the buccal side, you can easily orient it back in the impression in the same way. And since we do this indirectly, we are indirectly transferring the coping from the patient's mouth to the impression. It is called transfer impression or indirect impression. Now let us talk about the direct transfer. Okay, the direct transfer, or also known as open tray impression technique. Okay, now the open tray impression copings will have a longer screw which is longer than used for the closed tray copings. Okay, and in this technique we will be using an impression tray that is cut off above the implant, so that when the impression is taken, this long screw of this impression coping comes out through that opening. Okay, so as already discussed, we will place the open tray coping in the patient's mouth, attach it to the implant, and then verify using an X-ray. If the seating is good, we will use an cut impression tray. You can use a plastic tray which is cut off on top of the implant where the impression coping emerges, or you can make a special tray which is fabricated in such a way that it is open above the implant. Now the impression material is placed in the tray and loaded in the patient's mouth. Now the difference using an open tray and a closed tray is that before removing the open tray impression from the patient's mouth, we need to unscrew the screw which connects the impression coping to the implant through the tray. Now the tray is already seated in the patient's mouth, and as you know, we have a long screw, and this long screw should come out through the impression, through the opening in the impression tray. So once you have this screw coming out through the impression tray, you have to remove the screw before you remove the impression. Okay, so once it is unscrewed, the impression can be removed, and when you remove the impression, both the impression along with the open tray comes out, and that is why we call this a pickup impression, as we have picked the open tray coping along with the impression. And Since it is also a direct transfer of the impression coping along with the impression, it is called a direct transfer. So these are the different techniques for taking implant impressions. Okay. What is the advantages and disadvantages of open tray versus closed tray? So using a closed tray is an easier technique. When you have posterior segments with limited interart space or limited mouth opening, it would be better to use a closed tray impression transfer. When implants which lack sufficient parallelism, it is always better to go with a closed tray transfer. Now, coming to the advantages of an open tray transfer, when you have a thick, soft tissue, or if the implant is excessively submerged, it is better to go with an open tray transfer. When you have multiple implants in an arch, if you splint all the open tray transfer copings together, you will get a very accurate impression. Okay, so these are the different impression techniques for implants, and these are the advantages of each of them.